everyone, welcome back again to my YouTube video channel. I have another case today to share with you guys, and thank you for tuning in. I'm glad you are here, and I appreciate the following and support this channel to grow and to help other dentists and dental assistants in terms of education purpose. I have a case today again I want to share with you, and let's talk about this case today. Okay, let's go back to the original case. So guys, want to share this slide here. Again, welcome to my YouTube video channel, everyone. Just want to show you a case for young adults, how to handle a crowded teeth or in the young adults growing case. This patient was coming to my office, and this is the first slide here. This is how she show up with upper teeth crowded and lower teeth crowded. You can see intraorally very crowded on the bottom teeth and also very crowded on the upper teeth. She came to my office when she was around 13 years old. And so we start talking to her. She didn't decide to get the work done until when she were close to 14 and a half. So the K was starting, we gave her an option of either 4 bicuspid extraction or just expanding and finish the job. And she seemed to want to not touching her tooth, and she want to have better hope for the discussion about the airway space. And if we extract in the teeth, as you can see, the tongue kind of large enough that if we take it out, the tongue gonna give her more trouble, class 1 molar occlusion here. And so the idea is to get braces done. This is right after so we get done. Everything was straight. Her gum was kind of puffy because of wearing braces quite a while. So here's the case. So this is before the art. Now you can see immediately, this is after a month later, everything look more healthier, and the teeth become very, perfectly aligned. So patient was happy, and I'm happy as well. This is lower teeth, and you can see that straight immediately, and this is after. Again, this is before, this is right after, and you see after a month later. I'm sure it's going to get better if we go about. But anyway, the idea is to show you that when the patient are in the growing state, we can accomplish the case with stimulate the alveolar bone growing with the night tie wire. It worked really well. Again, this is her case. And so we have a document that when we start this case, we move teeth straight to anterior teeth and move this one out slowly but surely. We're able to do that. Same thing here. We're trying to move the crooked teeth on number 10 here, and eventually we were able to straighten it out. It takes time, everybody. Not like I'm not saying it's easy, but it's not that difficult as well. Case when the young patient is coming to your office, there's a high chance that you can do expander or using wire, and K will turn out wonderful. And so you can see this is before, and we start and we just improving and improving to get the job done. This is lower tip. You can see how the transition come about. I love dentistry. It's giving me a freedom of designing the case. And you can see here, this is before, a few months after. We use any tool available to move those teeth out. Here's another one. You can see there's a lot of open, there's a lot of strategy to open the space and everything. It again, you can see that open coil on the bottom and also on the top sometimes, but K can be done. Take a look again. Again, this different angle that I took, and again, you can see that we're really crowded, and then now she have a very attractive smile. before, during, 10 months after. I apologize for a random slide that I put together, but you get the idea. Patient again, this is immediately after the bracelet removed. This is immediately a month later. She's really happy, and I say to you that even though you look carefully, the enamel was really wear damaged because of the deep bite and the crowded teeth. But if we do enamel plastic and we straight patient teeth, and she become awesome, smile, person happy, and you can see right there like enamel chip, and then we can shape it up and keep patient happy. Okay, it's done. You can see this is before intraorally. This is after, as you can see. It just get better and better as you refine the case and take your time. Patient love it, and we are happy when patients like it. In conclusion, every case is different. I'm not saying every case is the same, but you have to look at the age of the patient. You have to evaluate carefully whether the oral space, airway space before you decide extraction. Nowadays, there's a study indicate that there is airway space related bicuspid extraction. So we have to be careful. We want a patient give a long-term physiology, healthiness, and rather than focus on cosmetics, aesthetic profile, and end up having patient have to wear CPAP and all of that. So I'm a conservative dentist. I try to minimize, not minimize invasive technique in surgery as well as in physiology of the patient. Any question? Feel free to ask me a question. Thank you again for watching. Hope to see you another video, and thank you again for subscribe to my channel and continue support my vision of this channel is to grow and to invite expert to come to this channel and share their knowledge. Thank you again for